So the new approach that we take rests on the premise that anytime we are exposed to something in our environment, whether it's cigarette smoke, changes in our diet, an infection, our bodies react to that. And that reaction is mediated through changes in our what we call gene expression. And that's just basically the pattern in which some genes are turned on and some genes are turned off. So what we've done is we've taken people who are showing up to the emergency department to see their healthcare providers who are having respiratory complaints. And what we found are some elements, certain genes, that are turned on and off in a certain way that is very characteristic of a response to a viral infection. Other sets of genes that are turned on and off in a way that is very characteristic of a bacterial infection. And then other genes that are turned on and off in a way that is indicative of no infection at all. The reason that's relevant is because of how we manage them and how we treat them. Bacteria infections are usually treated with antibiotics. Virus infections are not. And the issue is that despite the fact that most of these infections are caused by viruses that don't get better with antibiotics, most patients end up getting an antibiotic. And that has consequences both for the patient and for the public health. We're now very frequently encountering situations where patients are presenting with infections for which we have no available antibiotic therapy. And so by decreasing the amount of antibiotics that are used in general is one of the strategies to try and improve the antibacterial resistance problem.